Hi guys, this is Jen, as you already know. I'm just going to do a voiceover PowerPoint just so we can go through some of these really important next topics. We're going to talk about time management, then we're going to talk a little bit or recap prioritization, and then we're going to get into delegation, which is very important, that has a lot of concepts with it that are really going to affect you in the nursing profession. And then this will be saved as leadership with narration 1, and then I'll do conflict and reality shock as leadership 2 with narration, just so they're not as large of files. So we're going to go ahead and just really, these were things that you guys have already been practicing. You really have been in clinical and with our questions and case discussions. Many of you have learned managing tasks, managing time, managing others, and managing your time in the clinical setting. And I'm sure that you have changed significantly from when you were or where you were first semester to now. So again, anytime you're organizing time management, it involves organizing care according to client needs and priorities. And you need to know if you yourself are a good time manager or not. Online learning is going to make you a better time manager, or it'll lead to procrastination, one or the other. So when we have nurses who display really good time management skills, they have a lot greater productivity, they have decreased work stress, they really are able to prioritize healthcare, make sure it remains quality care, and they actually feel better about the care that they give. Many nurses you will see, and I'm sure you've seen it in clinical already, maybe they're the nurse that's giving report to you as they're leaving from the night shift, and they had a really bad evening or a night, and they couldn't get all the stuff that they needed to accomplish by the end of their shift done. And they felt, hey, you know what? I'm leaving an absolute mess for the next shift. So those things sometimes are uncontrollable. But then there's also nurses who don't actually have those good time management skills, and this becomes a routine or this becomes repetitive that you see. So when you have somebody who has poor time management skills, it really does impair productivity. It's going to lead to you feeling even more overwhelmed and stressed in your position. If you have a poor time management working ethic, a lot of times we see those big tasks that are really important, they're left undone. Just think of the nurse that maybe you come on after and you're like, how could they have forgotten to do that like gigantic wound dressing? How did they not do that central line dressing change that was due 24 hours ago? So a lot of those things are poor time management, poor planning, and leads to a lot of these can you do it better scenarios. Some of the times we see when nurses aren't good time managers, they wait till the end of the shift and do all their documentation. These are the nurses that are still sitting at the nurses station at 11 a.m. and their shift was over at 7. Nurses that don't think about, okay, I'm going in to do a dressing change. What supplies am I going to need to have with me? Nurses that don't delegate, okay, if they're providing all the care as soon as the opportunity arises and regardless to thinking about what else their other responsibilities are. Very important. Again, nursing trying to provide all patient care independently. Now this becomes difficult, especially when there is delegation concerns or nobody to delegate to or lack of patient care assistance. So there's a lot of other variables that play into here. Procrastinating and leaving more difficult tasks to near the end of the shift. That is something that I personally always struggle with. I'd be like, oh, I have a really big dressing change. I have this to do. I have this to do. I'll wait till the afternoon, or I'll wait till later in the shift when things calm down. Whenever you do that, something inevitably happens and you never get to it. This one's a little tricky because you want to be part of the team and you want to help out all your colleagues, but just assisting all team members when you are already drowning is something else that you have to be aware of. And also starting several tasks but never finishing any of them. So this is something else to be conscientious of. Again, reduction of interruptions is key to the success of novice nurses. You know, where can you chart? Where can you prepare your meds? And you're going to have to change gears multiple times during your shift. You get your second new admission. You're going to have to reprioritize and know, okay, these are what I'm going to tackle for my task for the rest of the day to complete my care safely, effectively, without jeopardizing any patient safety. So again, learn to embrace flexibility. Change is inevitable, especially in your nursing shift, so you're going to have to find a way to work through it. Couple of time management tips, and I tell you this all the time. Relax, take a deep breath. You might have to spend 10 seconds or count to 10 in the par level just to kind of take a break away. Refocused, kind of like I say, you guys can do it. That's just getting everybody refocused, back on step. And again, many of you have already started working on your own type of worksheet to keep you organized, keep you on track, keep your notes, because remember, when you start getting busy, you're not going to remember what every one of your patient's lung sounds were, what their vital signs were, what tasks you had to do, what labs you were looking back for them. So again, re-energize. Caffeine, food, always important to keep moving. So that was time management. The next thing is prioritization. Now, prioritization, like I said, this one should look quite familiar. We already did this when we started out the first day of third semester, because I knew and you knew that many of your NCLEX questions were all going to go back to which patient are you going to see first? Which task are you going to perform? And everything goes back to prioritization. So when we look at priority setting, again, it's decision making, it's organizing activities from most important to least important. And decision making is always based on evidence. So where are we going to get that evidence from when we are looking at priority setting? We're going to look at reports. We're going to look at the actual patients. We're going to know a little bit about all the different diagnoses. We're going to look in the chart. We're going to know just in our knowledge base that you've acquired to this point, which patients are our priorities. Now remember, this can change as soon as you see them. They might sound, there's patients that sound like a train wreck on a piece of paper, and you go in and you're like, everything seems okay. And then you'll get report on patients and you're like, oh, this patient should be a breeze this shift. And you walk in and you're like, oh, this is my priority. So again, priority setting requires decisions about the order in which I'm going to see patients, which assessments are going to be completed when which interventions are going to be completed, how I'm going to step out a procedure. Okay, I need to go put a Foley catheter in. I'm going to step out in my head exactly how I'm going to perform that procedure and envision what I need to do when I go to complete that task. So these things are all based on decisions that you're making. So you guys are already been practicing this with NCLEX questions. So some principles in nursing care. So life before limb, acute issues before chronic, actual problems before future or potential problems, and listen carefully to your clients. Some other things to help with prioritization is responding to trends and recognizing those trends, recognizing signs of complications, and also applying clinical knowledge to determine courses of action. So in one of your after spring break clinical preceptorship simulations done virtually, I have a document that you guys are going to be looking at and reviewing that really lists, it was one that I found just in my, nights of sleeplessness, of the most common complications that a nurse needs to be concerned about, and how to recognize that and how they're going to proceed then to care for those clients. So it really kind of summarized all those main things that you're going to be really, that's going to kind of make that alarm go off. I talk about that alarm that goes off in your head when you see things. So prioritization, we always do airway, breathing, circulation, disability, our ABCs. And remember, disability is our neuro assessment. And again, back to Maslow. You guys all need to take Maslow with you in your brain when you go to take NCLEX. And know that everything here on the bottom, okay, well, I'm going to use this nice little feature here I found, but now I'm just drawing. You're going to work from the bottom up, and your priorities are going to be everything that's down here, okay? Yes, I want you to feel good about yourself, but if I haven't met your physiological needs yet, then we're not going to move up the level or the hierarchy. So okay, I'm going to have you look at question 1, and we're going to move to the next slide. So we have all of these patients here. Now, you have to be thinking in your brain, what would be the top priority? And I would pick a patient who's been receiving a blood transfusion since 4 a.m. The second one I would pick would be a patient who needs rapid onset insulin before breakfast trays. Then I would do the patient who last received pain medicine at 4:30 because they can have it every 4 hours. Then I would move to informed consent. And then the last person that I would move to would be the patient who's being discharged and needs reinforcement of dressing change teaching. Okay, question number 2. An older adult client who is on fall precautions is found lying on the floor. Which of the following actions is most appropriate? So, using the principles of nursing process, we're going to go with an assessment first. Okay, so I hope everybody chose examine the client for injuries. Question number 3, a nurse is preparing to initiate IV therapy for a patient who has a prescription for morphine, 10 milligrams IV bolus. Using time management principles, which of the following actions should the nurse take first? And I hope you chose mentally envision the procedure when collecting the supplies, so that when you go in and do all of these other steps, you are prepared. Question number 4, a nurse is participating in a quality improvement study of a procedure frequently performed on the unit. Which of the following will provide the most relevant information regarding the efficacy of the procedure? So if we were doing a QA, the most important information that would give us any idea of the skill, the performance, whether or not it was done appropriately, would be incidence of complications related to the procedure. Yes, we want them to be satisfied, and yes, we want to know how many times they did it. And yes, we want accurate documentation. But this is just like anytime you're involved in quality assurance, the most important thing is, in addition to just doing the quality assurance, is doing what? Getting the information out to the staff and making a change, hopefully a positive change, but sending out that information and disseminating what you found and what you're going to do to change policy or procedure. Okay, so I'm sure at this point you're probably tired of listening to me. We're just going to go actually into the most important piece. We're going to go